This is Stephanie Manning, and this is my presentation for Nursing Capstone. I chose Baptist Health Corbin for my practicum site. I worked alongside Kirby Kersey as a nurse practitioner there in the emergency department. Baptist Health Corbin ED has 17 beds, one of those serving our Trillium Center for psychiatric evaluation. And then there's a fast track emergency department that has 13 beds. My three objectives for my time with Kirby was understanding how implementation of EMR into the emergency room can reduce chart errors, ordering errors, and medication errors. I wanted to examine EMR's impact on patient outcomes and quality of care. I wanted to see how using EMRs can improve efficiency and decrease emergency department wait times. I also wanted to see how using mid-level providers did that as well. I accomplished these learning objectives by using my platform for discussion and best practice unit meetings with all levels of staff. I spoke with nursing staff, mid-level providers, doctors, and administration. We also use these discussions as areas of concern, best practices, and just discussion of day-to-day things that we thought was pertinent to patient care. Comparing what I saw and what I was doing during my practicum experience to what we were doing in class and reading the literature. A healthy work environment. Baptist Health does a great job, I think, of both leadership qualities as well as providing a healthy work environment for their employees. After reviewing several articles, spending time during my practicum, and reading the attributes of a healthy work environment, I believe Baptist Health Corbin emphasizes maintaining a positive, healthy work-life balance and recognizing the importance of fostering a team approach to healthcare. Each of the domains discussed by Sherman and Pross, I saw in almost all of the employees there in the emergency department, specifically the leaders there. And Baptist Health Corbin recently received an award. This award is recognized by the CDC Worksite Wellness Scorecard. You get points assigned for proven health promotion strategies in the workplace, such as tobacco control, nutrition, physical activity, stress management, and organizational support. The awards are open to all Kentucky employers that have a worksite wellness program. And Baptist Health received Platinum Award this year for its exceptional commitment to employee well-being and exemplary leadership in managing employee benefits. Last year, Baptist Health received Gold, and the year before that was Silver. So they're doing a great job with that. I'm sorry. And another topic that I saw in practicum that we discussed during classroom was quality and safety. As discussed in Module 2, like all emergency departments, Baptist Health was extremely busy, and they are dedicated to providing the highest quality of care to all patients in both a safe and timely manner. As we all know that ER wait times is a great place for patients to fall through the cracks, and it's a big threat to patient safety as patient conditions can really change as they wait in the lobby. So working with Ms. Kersey, I shadowed her, and using a mid-level provider to see lower acuity patients in a quicker manner allows for the higher acuity patients to be seen quicker and more effectively. And on weekday nights, Baptist Health Corbin does not have a mid-level provider on staff, only on the weekends. So I worked with Miss Kersey on a weekend, and we compared some numbers from the night before, and we had seen a decrease in 44% decrease in wait times as far as triage to be seen by the doctor compared to the previous night. And then there was a 75% decrease in left without being seen in AMAs. And this is a great opportunity to use both EMR technology, mid-levels in a fast-track environment to increase quality of care and decrease patient safety concerns. And that was really interesting to see how that worked. And then another thing that we discussed in class that I saw was the interprofessional team communication. When you're working specifically a high acuity patient, like you would say a code or intubation or something like that, you will look around the room in there and see respiratory, radiology, lab, nurses and techs, and all kinds of different levels of providing, but at the end of the day, patient care is our number one priority. And Baptist Health does a really great job at communication as well as transitioning care. As we all know, poor communication during transition of care can really be detrimental to a patient's condition. So when you have poor communication, that leads to inconsistent patient monitoring, possible medication errors, delays in diagnosis, and delay in care. And Baptist Health has done the following, and I got to see most of those to help improve transition of care. And they have implemented an electronic medical records, which is Epic is what they're using now, to standardize medication recons. They've used pharmacy more involved in the transition of care to do the medication recons. They're using hospitalists and referrals, and case management is a big deal for them right now, as well as they use what is called SBAR, which I thought was very interesting to see. The Joint Commission stated that this is an industry best for standardized communication, and regular use of this as a unit-wide commitment really promotes quality and patient safety. It helps individuals communicate with each other and set expectations for their communication. When you know what you have to tell the person and you know what is expected, you will notice if something's missing from the data. And then EMR, recently Baptist Health implemented Epic as their new program. The benefits have significantly outweighed. And we, during my clinical, were right in the middle of the implementation of that. And it was really cool to see how using the EMR, specifically Epic, can really decrease medication errors and any kind of diagnosing errors or anything like that. And as a result, they received another award. Baptist Health as a system achieved Most Improved status in the 2016 Most Wired Awards, which are based on the results of an 18th annual Healthcare's Most Wired survey released yesterday by the American Hospital Association Health Forum.